blanching? Do you have a diagnosis? Might be called Raynaud's? Maybe. What's going on, Secoya Nation? Dr. Schilling bringing today's wellness wisdom. We're talking about Raynaud's. This is something that one of our participants recently brought to my attention. Enrique, we'll call him. And we also had someone a couple years ago deal with this. I know a couple of my family members dealt with this. One of our team members deals with this. So, Lila, is that what we said?
Sure.
Yeah. A couple years ago, Lila was dealing with, kept her from staying active. So, when you understand that your fingers changing colors or losing circulation, things like that, has a specific reason, what we're going to do is we're going to break down for you some of the neuroemotional constructs and a brief touch on what happens neurologically. Quick call to action: if you have a topic you'd like to speak about, as we ask you every time, please type it in below. If you want to expand on this, something related, whatever it is, feel free to type it below, okay? So, why do your fingers blanch? People are like, oh, I touched a cold piece of chicken, or I went outside and touched my car, or this and that. But why is it only these fingers? Some people have all of them, but oftentimes it's like one or two, or it's like this and something like that. So, your hypothalamus, part of your brain, determines like what's important in your body, okay? And then the brainstem is involved in the midbrain, is responsible for the constriction of blood vessels and things like that. So oftentimes the fingers, which is where we oftentimes have it, I've heard people say, well, you had frostbite at one point or this and that. But there really is a little correlation between frostbite and Raynaud's that I've seen in the literature. So if one finger blanches, something like that, you're either trying to hold on to something or having trouble letting go of something. So to that end, if we talk about, it's like a self-evaluation. Your brain says, I can't be efficient or effective at either letting go or holding on to something. Okay, that's how that's going to relate. There's also the idea that because it's the fingers, it's like I can't hold on to or catch the thing in my life or the objective, the goal, or whatever it is, or I can't maybe even keep my cool. Of course, the hands are cool. But it's like it's all about holding on or letting go and trying to catch something. It could be that I don't feel effective in my work. It could be related to inability to execute work in my hands, because it happens here all the time. That can affect the blood flow. As far as pushing things through to the end, like seeing things through the end is also relevant for your brain-body connection when your fingers or your toes blanch. I don't know of too many people that have ever shown me or expressed to me their issues with their toes, but it oftentimes is exclusive to the hands. So let us know if you've ever had it on your toes and how long it takes to go away, what you have to do to get it to go to blood flow to come back and things like that. I usually recommend people change their body, jump up and down, move their blood flow, get their mind off of whatever they're thinking about, shift their focus, and that'll change your biochemistry, and that'll change how your brain is processing things, which will allow you to then reestablish the blood flow to your digits. So there's a fear, it's like a difficulty returning home. I'm in danger of death if I return home, or I might be in danger of death on my way home. That's something related to the Raynaud's. It's something in the genealogy, something in the heritage stress is related to death and things like that, because part of it is I want to hold the hand of the person who's either dead or dying. I don't want to let them go. I don't want to, it's holding on. Remember the common theme, letting go or holding on. It can be referred to as, what am I feeling forced to do or obligated to do? Those are things that are related to Raynaud's as far as the literature goes. And then there's ultimately, it's like one person might be dealing with, I don't feel recognized by my family. Okay, there's a self-evaluation because I'm not feeling recognized, acknowledged, or appreciated by the people in my family, my relatives, and things like that. So that's how I would help a person relate to their condition, because if it comes and goes, it's not a permanent thing, then it's a brain thing, it's a blood flow thing, it's a neurological pattern that can be reversed, because if it comes and goes, it's a temporary trigger, something has triggered it. Your brain might have a stress associated with cold, so when you grab that chicken breast or when you grab that cold door in the car, whatever is in the freezer, you get that trigger, there's your trigger. So keep these in mind, take them into consideration, run up the flagpole, see which ones are relevant to your life and relevant to your family members' lives, and share with them if you find someone that is dealing with this, because ultimately there's people out there, a lot of people. I remember working with one of my family members a while back, and we tied it back to her stress related to cytomegalo, and it was, I forget what relationship it was, but this was 5 years ago or something like that. But there is a root cause. So just don't lose hope. Just get with someone who can dig into this and figure out what the root cause is. And if you like this kind of stuff and you want more information like this, just sign up for our email list, and we'll happily send you email information to your inbox so you can be informed, keyed in, clued in, tipped in, or tipped, turned on, whatever it is. You're clued in to the most up-to-date stuff on natural wellness, and we're excited to serve you in that way. All right, guys?
Dr. Schilling, can you share more about your credentials, background, and how you discovered German New Medicine? How does that tie in?
Absolutely. So I consider myself, I don't know if it's backwards or not, I work with people holistically. So I consider myself a holistic clinician. I've made that up because it really means I'm working with a person's brain, their body, and their biochemistry. So I have a degree in engineering, mechanical engineering. I also have a degree in chiropractic medicine, which helps me see things through systems, helps me see things through, like, what's the connection between the brain, the body, the biochemistry, and the triad of health that we focus on here. German New Medicine has been around for decades. Dr. Hammer initiated it. He was a German physician that was basically forced out of practice because he wanted to help people heal. He was doing brain scans to figure out conflicts in their brains and how it tied into their body, looking at the cortical homunculus. And so this information was then held in if I remember the story correctly, and don't crucify me if I'm wrong, I believe it was held in a library sort in Canada where they were holding on to this German medicine information, and then it started becoming more widespread. There's one woman, I forget her name, who runs the site learninggnm.com, learninggermannewmedicine.com, which is a wealth of information. She's basically taken Dr. Hammer's work and made it into easily understandable stuff and things like that. So it's a passion for me because the greatest sense of healing I've ever had in my life has been through working in my brain and helping my brain-body connection heal. And so through clinical practice, I've worked with people's bodies and their physical health. I've worked on their biochemistry, doing lab work and blood work and stuff like that. And then when I got to the brain, when I got to unlocking German New Medicine as far as the key to collect it all or bring it all together, now it's not about me, it's not about what I know, it's about what the elders know. It's about the information that's already out there that I say, okay, I don't have to be the smartest guy in the room. I'm standing on the shoulders of the giants that have already done this stuff. So I'm looking at this information like, this is not like proprietary data for me. This is stuff I'm bringing to you that's already out there, but you're just not getting it delivered to you. Okay? It's because I want to empower you to know yourself best and understand your body the best and be able to take action the most proactively so you can avoid this kind of crap. And if there's something you become aware of, then you can change your life to then create the life you want. That's the whole purpose of these sessions.
Thanks.
Cool. All right. Sweet. We love you. Appreciate you. We'll see you tomorrow for the Wellness Wisdom. All right, guys. Thursday. Yep.
Wellness Thursday.
Wellness Thursday. Here we go. All right, guys. See ya.